Good morning, Desiree. We're coming live to you from the Caledonian Stadium in Pretoria, where over 1,000 homeless people are housed here in tents provided by the Gauteng province. And they actually are having some concerns that though the accommodation has been provided, but they've been having problems with the provision of food, provision of water. Some saying that for the past 4 or 5 days, they haven't had water to bath and as well as enough blankets. But just to hear as to exactly what the problems are, I'm going to speak to a few of them to tell us what exactly the problems are. Abuti, if you can just come this side. Tell us exactly what the problems are here.
The situation is that the guys they've been brought at this place. They've been brought on Friday. And the thing is, the place is overcrowded. And each and every day the number is rising, it's going up. The facilities around here, they are not well for the people to be used, to be utilized by them. As you can see, the tents around here, they are not enough. People are being crowded. At some point you find that there's about 13 or 14 people who are sleeping in one tent. And then there's people who also sleep up there in those benches at night. There is no facilities for water and sanitation and stuff. As you can see over there, one of the guys is using the tap just to bath. There's a problem with food. There's people who are under abstinence here. And the health is failing these people. The service providers who are bringing food in here for these people, they are failing them. So it's one big of a challenge that we are having here. As you can see, the place already is overcrowded. The number has risen over to 1.2 to 2,000 rand. There is no mask, there is no gloves for everyone who's around here. So that's currently the situation that we are having here. Even the sanitizers are not here. And you should understand one thing. This is a state emergency it's a state emergency. And the major thing here, it's a corona issue. But now, the thing that is happening is that since they are sleeping in that tent, you find about 8 people who are sleeping in there. The chances of them infecting everyone in there, they are very high.
Thank you.
They are very high.
Thank you.
So the government needs to do something with the service providers that he has appointed. He needs to do something with that, because it's not okay. Even the place itself, it's not secured for the guys who are here. So those are the challenges that we are having here.
Surely you also know about the issue of social distancing that every one of us has to observe. But I see you guys here are just, crammed together. What are you saying about that? Are you not educating yourselves about the issue?
Hence I said that they just brought these people here. We are trying to do it on our own, but because we don't have anything, we don't even have the sanitizers, but we cannot do that. And they keep on bringing a group of more people each and every day. So we cannot be having a social distancing here, because all of these tents, there's about 13 people who are sleeping in there. So the risk of people getting the virus, it's very high. It's very high. So the social distancing issue, it is not working for us here. It is not, because there is not even anyone who's coming to control the situation or anything that's going on in here.
We're not even united, my friend.
Others, they are sick, others, they have a low stroke. What is now?
Okay, and the other issue, you spoke also about the lack of provision of food. Some guys whom we spoke to said that the last time they ate was yesterday.
Yes. Coming to the issue of food, the government has appointed certain NGOs to come and bring the food in here. But it is not happening. It is not happening. I'm telling you about the issue that happened yesterday. The number it's more than 1,000 rand here, but they brought about 200 meals.
Yes.
And it was not even enough for everyone to eat.
Yes.
And the very same meals that they brought you, I can show you the picture of the food.
Yeah.
It's not that you won't even eat that yourself. You cannot eat that food. So it's a problem. They don't have a time frame of what time do they bring the breakfast and the lunch in the morning and the supper. They don't have a time frame. At any given time, they just walk in here and bring food. So that's one of the issues that we're having here, serious issue.
Even now. Thank you, Abuti. Desiree, as you can hear, seemingly the situation here is very dire. The issue about food, the issue about social distancing, If I can just ask my colleague to just, pan around a bit for you to see. These people are just, cracking together. Some are, sitting over the stands there on the stadium. And seemingly the issue of social distancing, for them, it's just a myth or something that is impractical for them to do. With that, Desiree is back to you in the studio.
Molemo Waone, while we have you, the footage you're showing us is problematic on so many levels in terms of the social distancing, in terms of the hygiene that is required at this time. What are officials saying?
At this stage, Desiree, we haven't been able to speak to the officials about the situation, just to find out, what arrangements or what measures, they're putting in place to ensure that whilst they are accommodating these people here, they also practice, hygiene. They also observe social distancing, but we are yet to talk to the officials about that.
Molemo Waone Mothoa, thank you so much for that report.